I'm back at Chevron Advanced Medical and Skin Cancer Clinic for another skin check. There's a mole on my back that Dr. Thant is keeping his eye on, so we're going to have another look at it today. I'm good, thank you.
That's good. Okay, so it's your follow-up skin check.
It is my follow-up skin check, and I got the notice a year ago.
Yeah.
I got the notice a year ago because I know that you've got me on watch on one mole, and I got the text, and at the time, I mean, it's so hard with Spencer and everything because obviously he's a toddler. Because I'm looking after my toddler.
Yes. Yeah.
And I wanted to come in, and it's just been so busy. Oh no, is that the one we're looking at?
Yeah, that's your spot. Yeah.
Oh no.
And I think we froze that one off.
Yes. Oh no, I'm really dreading it. And so I kept wanting to come in, and then I got another text from the medical centre, which I do appreciate because it's like he didn't forget me. Like it was keep reminding me. And so now I'm here, but I'm a year late. So you put me on once a year, and it's now nearly 2 years since that was looked at.
Yeah, so we'll compare the images, hopefully there's no change. And then any updates with your family history?
No updates, so I'm obviously not postpartum anymore though.
Yeah.
But no, look, I don't have any skin cancers in my family, so
You said they're in Finland.
Yes, and but see, they grew up without sun exposure.
Yeah.
Do you know what? There is a little thing between my toes that I have been wondering about. I can't. Oh, I'm so sorry. My feet are disgusting. I don't know if it's that foot or the other foot. I think it's the other foot. Yeah. It's a tiny. Yeah, let's hope it's not a melanoma. It's in between these two toes anyway, so it's either one of my feet. I can't see.
Here?
Yeah, is it little tiny and brown?
Yeah.
Yeah. Oh no, not there. It's actually between my toes. It's yeah, I think it is this one.
How did you spot it?
It's is it on this side here? Or that side? Or is it on? It was probably a piece of dirt.
It could have been. But
It's not. It is there.
You do have pigmentation here. That looks nice.
Is it a little tiny brown spot?
Yeah.
Because I can't see. I'm not wearing my glasses.
Oh, okay.
But you can see a little tiny brown spot,
Yeah,
and that's fine. That's not a festering melanoma.
Yeah, no. And any other spots you're concerned of before we start?
That was the only one I wondered that. I did see it, and no, honestly nothing. Like I can't feel anything or anything. So do I need a full body or just a spot?
Yeah.
I do.
Yeah.
Because it's been 2
In case
years.
there's new spots that have
I
come
know.
up.
Yeah. Look, I appreciate the care. I do, but please don't find anything.
Okay. So we'll get you down to your underwear. That's all.
I'm so scared with these medical tests because I know because you're really looking for one. Like, do you know what I mean?
But it's good to find it early instead of waiting for it to grow deep.
So face up. Yep.
Yeah.
And I'm not postpartum anymore, but I haven't been doing my Pilates for a while, so excuse the flap again.
I'll start on your hands.
Yeah.
And then what about any sunburns in the past couple of years?
I have not had any sunburns because I'm really careful with sunscreen. So no, there's been nothing new. I was actually going to ask you if there's been anything new in the research or any treatments or.
There's still those immune therapy.
Yeah, for melanoma.
Yeah. I don't know when though. If I'm administering that. Then we'll go to your other hand. That's normal.
Yeah, and
It's
you
like
know,
fibrous tissue.
is it?
Yeah.
I was wondering, is it a liver spot?
No, it's called a dermatofibroma.
Oh, that's good, because I think I'm getting a couple of those.
No, that one's different. That comes up from trauma. Like you
Does
used to cut yourself there.
I
or have
probably
a deep
did.
insect bite or something.
I probably did.
It's your ears. Has it been like a bit flaky there?
No.
Hasn't been picking at it?
Does it? No. Does
Yeah.
it look bad?
It's getting a bit flaky.
Ooh, is that bad? Sounds bad.
No, so if you keep feeling the flakiness, then I would freeze it off.
Oh, right.
But if it hasn't been bothering you, then we'll leave it until next time.
Alright.
Do you wear glasses?
I do. I do wear glasses.
And then anything not healing around your lips?
No. I'm so sorry too. I know you said not to wear makeup. I remember that from last time. It's the Gold Coast. I wouldn't wear makeup if I lived in Tamworth. But it's hard here, isn't it? Everyone's like dressed up all the time. Well, not dressed up, but...
Anything in between or under the dress?
No, no.
So yeah, those red spots are normal.
Those red... I mean, this can come right down. There's a big granny.
And then those you can freeze off if they annoy you, otherwise you can leave it until
Oh,
next
yeah,
time.
that's funny. No, it doesn't. It doesn't bother me at all.
Yep.
If anything, it's always the ones on the back
Oh, yeah.
that I can feel sometimes. Like,
Yeah.
I could feel one the other day in the shower, and I think it was a pimple actually that had gotten really big.
Yeah, by your toes it's just that one there, but it looks normal.
Oh, that's good, yeah.
And then same there. Maybe that's the one you saw.
Oh, it probably is, yeah. It probably is.
Yeah, that one's also normal.
Oh, that's good. You're so clever that you can just tell by looking, because obviously as soon as you see anything on your skin, I have no idea what one would look okay and what wouldn't.
Is that one new?
Yeah, I know what you're looking at.
Yeah.
I don't know.
Take a picture, because it looks newish. But it's still okay.
Is it?
Just in case it grows into something not good.
Oh, right. Well, thank you for taking a picture. Oh, look, it's so good to have proper medical care though, isn't it? Like, I am really grateful, even though, yeah, you do get scared. Oh. Oh, is that it there?
Yeah.
Oh, wow.
So just 1 millimeter diameter. You can see it's got all those dots, which can be a sign of growth.
Oh, wow. Does it look like it could be a melanoma?
No. But because there's dots, it means it's still evolving.
It looks horrible. So you don't want, so are these bits of your skin that have got DNA damage, like from sunlight or something? Because doesn't sunlight mimic because isn't there a C, T, G something, you know, the letters of the DNA or something?
Yeah.
Doesn't sunlight mimic one of the letters and change, is that how it works or not?
It's mainly the UV radiation that can damage the DNA.
Okay,
Then, yeah, let's turn over.
Oh, yeah.
Face down.
Yeah, because so is that, do you think, a little bit of skin that has got some DNA damage and it's now starting to go a bit haywire? Is that what it is?
No, because you can see your surrounding skin there actually doesn't have much sun damage. So
yeah.
in sun damaged skin, you often see these like.
Oh right, okay, yeah.
And you often get like these vessels in the surrounding sun damaged skin. So that area doesn't really have sun damage in the surrounds, but but that is like a melanocyte.
Oh.
So like it's a melanocytic.
And it could turn into something nasty potentially.
Because it looks like it's growing with all those dots in it.
Oh, how can I make it stop growing?
You can't really.
I can't.
It's just what it's doing.
What if you take it out? Would that?
Then it means we don't have to monitor it anymore. And then just behind this.
Oh yep. Oh sorry. Just move my hair's a pain.
And then, is there anything in your hair that's not healing?
No, I mean I can't, and I scrub my hair pretty well. Like when I wash it, I give my scalp quite a nice massage, so I can't feel anything bad or like nothing's irritating me or anything. But yeah, it is. If I'm gonna feel anything, it'll be something on my back. So you can move this up and down as needed, or
let's take a picture of that one.
Oh yeah. Does it look bad to you?
No, but I'll
Yeah, yeah. So I assume the new one's the darker one?
No. So this is from today.
Oh right.
Yeah.
But it is bigger. Is it? Or?
No, it's not.
Oh, excellent.
So it's similar.
Okay, yeah.
And then next to it is like just pigmentation from the sun.
Okay.
So yes, that one is okay. So just keep monitoring it.
Yeah. Oh, that's a relief.
And then you can see that one's gone.
Oh yeah, that's two, yeah.
That
that's right, you took two.
And then that one should be there.
Yeah.
So that's the ZK that we froze off.
Yes, you did an excellent job too. That was like really well done. Thank you so much. Yeah, just pull it down like this.
Another one that we're comparing there, so do those little lumps irritate you?
No, they don't. No, they really don't. Which lumps do you mean? Like that?
That's a little blackhead cyst.
Oh, it might have been because there was a pimple or something. No, actually, I don't think it was there. I think it was lower down somewhere. But it was sore as well. But I think it's gone away.
Yeah, but those ones irritate you. You can freeze them off, otherwise just bleed it.
Yeah, no, they don't really.
Okay, so we'll compare that one.
This is terrifying though, having any skin checks. Like it is.
Is it?
Like, oh. Do you ever find melanomas straight up? So you know it's a melanoma. Like you
Yes. Yeah.
Oh, how do you tell someone? What do you do?
So you start off with a excisional biopsy.
Yeah.
So you take a biopsy, but the biopsy actually gets rid of the whole lesion. But if it comes back as melanoma, then you need a second cut.
Yeah. But all I'm saying is before you even biopsied it, you're pretty sure it's...
Yeah.
And do you tell the patient?
Yeah, if I'm pretty sure, then I'll tell the patient.
Yeah. Wow.
Okay, so that one is still okay.
Oh, that's good.
And then I just like to look at the zoomed out pictures as well, in case like a new one pops up that we haven't seen before.
That's so clever, your machine. So you can actually see that skin when you zoom out the picture, probably better than you can with your naked eye. Can you, like on the computer or something? Or oh, that's awesome.
And then, yeah, the thigh one is like an easy spot for you to keep an eye on.
So this one you mean?
Yeah, in case
So I
it's
can't
new.
even... Okay, yeah, this
Yeah.
one. I mean, it's... Alright.
Yeah, so if it's like growing or changing, then come back before a year.
Yeah.
Otherwise, 12 months is ideal for the next skin.
Yeah, I know, and I do appreciate the notice. It's it's one of those. It's hard to ignore that, isn't it? Because once you get the notice, it's like, oh, I better go in because if I don't, there's going to be this melanoma that's growing, and I'm ignoring it.
Yeah. And yeah, melanomas you want to catch while it's like still 0 millimeters thick.
Okay.
Because the deeper they go, then the higher the chance they have of having spread.
So if you catch a melanoma really early, like say if you're pretty sure that this was a melanoma and you caught it at this size,
Yes.
what would be, you reckon it'd be pretty good, or is that already getting too big?
No, that's a very small size.
Yeah, is it? Yeah, I know, it's so tiny.
Yeah.
And how would you treat? You're just cutting out? And that
Yeah,
would be-
so if you pretend that one was a melanoma,
Yeah,
then the first cut,
yeah.
you need about 2 millimeters all around it.
Okay.
So that,
Yeah.
and you cut it like that.
Oh.
So it's just a small scar.
Okay, yeah.
And the reason why we cut close to it is because if it was a deep melanoma, then you need a lymph node biopsy. So they inject the scar from here to here with dye, and then they follow that to your closest lymph node, which will be like in the groin. And then they'll take the lymph node out and then do the second bigger cut.
Oh no.
But if it was not a deep melanoma, then you don't need the lymph node taken out. But you do need a second, bigger, deeper cut.
So it could have already gone to your lymph node, like it, so
Yeah.
it goes down and through.
The cutoff is usually at about 0.8 millimeters thickness for the melanoma.
Man. And if you do cut it out and remove a lymph node and all that, are people okay?
Prognosis is like not as good as if it was 0 millimeters thick. So yeah, better to get them.
Oh, yeah, it is. It's really important work.
Yeah.
Australia, we've got the highest rate, don't we,
Yes, yeah,
in the world?
yes. And then followed by New Zealand.
Followed by New Zealand.
Yeah.
Wow.
Probably like a hole in that ozone area.
Is there a hole in the ozone layer above us?
We've got less UV protection in this area, Australia and New Zealand.
Do we really?
Yeah. That's why like, people tend to get less burned on their European holidays than if they're out in the sun here or in New Zealand.
I didn't know that. That is I truly didn't know that.
Oh yeah?
Thank you for sharing that. So being out in the midday sun in Finland, it really truly isn't as dangerous as being in the midday sun here.
Yeah.
How interesting. So it's not just our sunny climate, it's an actual ozone problem as well at the time.
Yeah.
Thanks for sharing that. You learn something new every day.
Yeah, all good.
I appreciate that info. That's very interesting.
Yeah.
So plan 12 months.
Yeah, 12 months.
I'll come back
Do
in
you
12
want a reminder?
Yes, I do.
Yeah.
I do, because that a reminder just does get you in, I think, and even if just a reminder just to look at the spot yourself, like
Yes.
you know, because I could just kind of forget that.
Yeah.
And in a year's time, will it be a full body again, or will it just be spot checking? You recommend full body?
Yeah. So
Okay,
spot checks are usually like in between. So like,
right.
say you've done your full skin check, and then like, I don't know, 6 months later you notice a new spot, or you notice that one's changing, then you should book in for a spot check.
Okay. Yeah.
Yeah.
And is there an age, like should as you get a bit older, should you have more regular skin checks? Is it an age thing or not necessarily?
It's more common as you get older, yeah. But generally 12 months is okay.
Yeah. Okay. Yeah. Well, thank you so very much.
Yeah.
I'm very relieved.
Yeah.
And I will be happy to come back in 12 months, and let's hope I don't stretch it out to 2 years this time.
Yeah. Yeah.
Thank you for your time.
Yeah, no worries. Thanks, Suvi.
Thank you. Well, that feels so good to get that done. I am so relieved that the mole that Dr. Thant was keeping an eye on was fine. And that's really interesting that there's a new one that we now need to keep a watch on. But like he said, it's better to just get in early. There are loud cars going past. It's better to always get in early and just keep on top of things. So it's just a relief to have that done.